Today, we will delve into the fascinating topic of the science of addiction. Addiction is a complex and often misunderstood condition that affects millions of people worldwide. From drugs and alcohol to gambling and internet use, addiction can take many different forms and can have serious consequences for individuals and society as a whole. In this book, we will explore the science of addiction, examining its causes, symptoms, and treatment options. What is addiction? Addiction is a chronic condition characterized by compulsive and uncontrollable use of a substance or behavior, despite the negative consequences. The development of addiction is influenced by a variety of factors, including genetics, environment, and individual differences. Addiction is a complex condition that affects the brain, and can lead to changes in brain function, structure, and chemistry. The neurobiology of addiction. The brain plays a central role in addiction, and research has shown that addiction is associated with changes in brain function and structure. Drugs and other addictive substances affect the reward and pleasure centers of the brain, releasing large amounts of dopamine and other neurotransmitters. Over time, repeated drug use can lead to changes in the brain's reward system, making it increasingly difficult to experience pleasure from other sources. Symptoms of addiction. The symptoms of addiction can vary depending on the substance or behavior involved, but some common signs include compulsive and uncontrollable use of the substance or behavior, tolerance, or the need for increasing amounts of the substance or behavior to achieve the desired effect, withdrawal symptoms when the substance or behavior is stopped or reduced, continued use despite negative consequences, such as health problems, financial difficulties, or relationship issues. The cycle of addiction. Addiction often follows a cycle of behavior, with an initial period of experimentation or recreational use, followed by more frequent and intense use, and finally, dependence and addiction. The cycle of addiction can be difficult to break, and many people require professional help to overcome their addiction. Treatment options for addiction. There are a variety of treatment options available for addiction, including medication-assisted treatment, behavioral therapy, and support groups. Medication-assisted treatment involves the use of medications to reduce cravings and ease withdrawal symptoms, while behavioral therapy focuses on helping individuals identify and change the underlying thoughts and behaviors that contribute to addiction. Support groups such as Alcoholics Anonymous or Narcotics Anonymous can provide a supportive and non-judgmental environment for individuals in recovery. These groups emphasize peer support and accountability, and can be an effective way to maintain sobriety and achieve long-term recovery. Prevention and harm reduction. Prevention and harm reduction strategies are also important in addressing addiction. Prevention efforts can include education programs to raise awareness about the risks and consequences of substance use, as well as policies and regulations to limit access to addictive substances. Harm reduction strategies focus on reducing the negative consequences of substance use, such as needle exchange programs and safe injection sites for individuals who use drugs. Factors that contribute to addiction. While addiction can have many different causes, there are certain factors that are known to increase the risk of addiction. These include genetics, trauma or stress, mental health issues such as depression or anxiety, and social and environmental factors such as peer pressure or availability of addictive substances. Genetics and addiction. Research has shown that genetics can play a significant role in the development of addiction. Certain genes have been identified that are associated with a higher risk of addiction, including genes that affect the reward and pleasure centers of the brain. However, it is important to note that genetics is only one of many factors that can contribute to addiction. Stress and trauma. Stress and trauma can also increase the risk of addiction, as individuals may turn to drugs or other addictive substances as a way to cope with emotional pain. Traumatic experiences, such as physical or sexual abuse, can also increase the risk of addiction, as individuals may use drugs or alcohol to numb painful memories or feelings. Mental health and addiction. Mental health issues such as depression, anxiety, and post-traumatic stress disorder, PTSD, are also associated with a higher risk of addiction. Individuals with these conditions may use drugs or alcohol as a way to self-medicate and alleviate symptoms, leading to the development of addiction. Social and environmental factors. Social and environmental factors such as peer pressure, availability of addictive substances, and cultural attitudes towards substance use can also contribute to addiction. For example, individuals who grow up in environments where substance use is normalized or encouraged may be more likely to develop addiction later in life. Types of addiction. Addiction can take many different forms, including substance addiction, such as addiction to drugs, alcohol, or prescription medications. Behavioral addiction, such as addiction to gambling, internet use, or shopping. Food addiction, which is characterized by compulsive and uncontrollable overeating. Each type of addiction has its own unique set of causes, symptoms, and treatment options. Dual diagnosis and addiction. Many individuals with addiction also have co-occurring mental health issues, such as depression or anxiety. This is known as a dual diagnosis, and it can complicate the treatment of addiction. It is important for individuals with addiction to be properly evaluated for co-occurring mental health issues and to receive treatment that addresses both conditions. Stigma and addiction. Stigma surrounding addiction can be a major barrier to treatment and recovery. Many individuals with addiction may feel ashamed or embarrassed about their condition, and may be reluctant to seek help as a result. Reducing stigma and increasing awareness about the science of addiction can help to break down these barriers and encourage individuals to seek the help they need. Conclusion? In conclusion, addiction is a complex condition that can have serious consequences for individuals and society as a whole. By understanding the science of addiction and the factors that contribute to its development, we can develop effective strategies for prevention, treatment, and harm reduction. Whether through medication-assisted treatment, behavioral therapy, or support groups, there is hope for individuals struggling with addiction to achieve long-term recovery and lead fulfilling lives. By reducing stigma and increasing awareness about the science of addiction, we can help to break down barriers to treatment and support individuals in their journey towards recovery.